Hello, my name is Marie Badiola. In my presentation, I will be talking about diagnosing schistosomiasis for a study of hepatitis in Uganda. An overview of what my presentation will cover is what schistosomiasis is, primarily the two species, Schistosoma mansoni and Schistosoma hematobium, DNA extraction and its importance, the study from Uganda which investigates the co-infection between Schistosoma mansoni and hepatitis, and my research. An introduction. Schistosomiasis is a disease caused by parasitic worms. It commonly occurs in Africa, Asia, and South America. An estimated 200 million people are infected and 800 million people are at risk. This makes it one of the most prevalent parasitic infections in humans. People become infected by coming in contact with contaminated freshwater. Contaminated freshwater means that the water contains the snails which host the parasite. Usually, this water is used for cooking or bathing. The two species which I focused on were Schistosoma mansoni and Schistosoma hematobium. The two affect different parts of the body, so both can be diagnosed differently. Schistosoma mansoni eggs are shed through feces, while Schistosoma hematobium eggs are shed through urine. DNA extraction is a procedure where the DNA is isolated from the nucleus of cells. The importance of DNA extraction includes helping with the development of diagnostics and drugs. An important aspect of diagnostics includes sensitivity and specificity. Sensitivity is the ability to find a true positive, and specificity is the ability to find a true negative. These are important because it allows the diagnostics for people to be accurate. There are different methods specifically for parasite detection. One is through stool, and the other is through dried filtered samples. These samples primarily include blood and urine. Detection through stool is when the stool of a patient is examined for eggs of the parasite. Some issues with this includes that it is not as specific as other methods. This is because some patients are asymptomatic, which means that they do not show symptoms of having the parasite. An example of this can be that no eggs can be found, even though the patient may be positive for the parasite. Detection through blood is when the blood is examined for the DNA of the parasite. It is the most common method of DNA extraction for the detection of a parasite. This is because there are more kits for it in the market due to its high DNA concentration outcome. The issues with this is that it is not as accessible for people in endemic areas. In addition, it is more invasive than other methods. In some cultures, blood is seen as sacred, and so people may not be as willing to get tested. Lastly, training is required for blood samples to be collected. This takes up time and resources. The last method is detection through urine. This is when urine is examined for the DNA of the parasite. This method is cost and time efficient. It is more accessible to other people, and no training is required to collect the samples. The main issue with this is that it may lead to a lower concentration than extraction through blood. In addition, the kits to this are very expensive. To overcome this, my lab optimized the kit protocol that was originally intended for DNA extraction through blood. The study in Uganda investigated co-infection between hepatitis and Schistosoma mansoni, as both can affect the liver. The study was conducted in the Gulu district of Uganda. The water sources which surround this district are comprised of large lakes. This study required researchers to take and examine stool specimen. The issue with this is that this method is not as specific as some people can be asymptomatic. Because of this, I obtained 50 samples from the lab and utilized them for my project. My main research goals were to examine, explain, and encourage. My main research project was to examine the 50 samples from the study and detect whether the patients had the parasite Schistosoma hematobium, Schistosoma mansoni, or both, or neither. After, I will explain how diagnosis through urine is more specific than diagnosis through stool. Lastly, I wanted to encourage the use of diagnosis through urine for further research to their study. My methods. The steps of filtration are fairly simple. The urine samples were filtered through a Whitman No. 3 filter paper. This step was performed by the researchers in Uganda. Once the urine is filtered, it is then left overnight in room temperature to dry. After, I utilized the optimized protocol for the Qiagen Camp mini kit. After the DNA was extracted through the use of the mini kit, primers for the parasites were used to amplify the parasitic DNA in the samples. The specific primers that I used were Schistosoma mansoni DNA and Schistosoma hematobium DNA. The amplification was done through a PCR. After, gel electrophoresis was used to analyze the amplified parasitic DNA. This showed whether the patient had one parasite, both parasites, or neither one. My results show that 35.4% of the total negative were infected with neither Schistosoma mansoni or Schistosoma hematobium. It also showed that 27% are infected with both from the total positive, but from the total samples, 18% of the people were infected with both. My work indicates that both parasites are present in the bodies of water which surround Uganda. This method of diagnosing through urine should be considered as it provides more information than looking for eggs in the stool. It is important to search for both parasites, as multiple parasites can be the cause for certain symptoms. Utilizing urine for a diagnosis is more sensitive and specific as the DNA extracted is a direct product from the parasite. Future research will be conducted. The study will continue on by using dried filtered urine samples as their research method because there is a prevalence of other parasites that can be diagnosed through urine filtration. I would just like to acknowledge the following people. My mentor, Dr. Clive Schiff, who guided me and allowed me to use his lab at the Bloomberg School of Public Health for my research. My supervisor, Gabby, who helped me on how to improve and conduct my research project. Lastly, I'd like to thank Dr. Rosen, who supported me throughout my research experience. Thank you for listening to my presentation.